Good morning, everybody, and welcome to 2021. Holy cow. Congratulations, everybody. We made it.
More teas, 2020. Tom's tip on Tuesday at 10, 2021. Oh, I love it.
So last year, we spent a good bit of time, and you gave us some fantastic feedback with regard to tips using Isolite. And Dr. Hirsch shared maybe 40 or different tips or so. Go check those out. This year, we're changing the format a little bit. And what we're going to be focusing on every week now is Dr. Tom's case of the week and how Isolite could help with regard to that. So this week, we're starting out with, I believe, a grafting procedure. Right. Is that right, Dr. Hirsch?
Right.
So if you would, what I'll do is you tell me, and I'd like to bring up what you'd like to show here with regard to the different types, the procedures that you've got here. So
Will do. Okay, so bring it up. So I'm going to introduce it. So what we've got, and you'll see this in a moment, I'm just going to talk for a second. And I'm probably going to trip all over myself today because I haven't done one of these before. But as a precursor, you'll now know and have been probably notified by your local dental society that dentists can now give COVID injections. You're going to have to take some courses if you want to offer that service in your office, but we can get COVID injections now. That has been approved. So this case is going to be a 47-year-old person because we are no longer allowed to say man or woman, male or female, boy or girl. 47-year-old person has to have this hairy beard. And tooth number 19 was failing. If you can bring that x-ray up on tooth number 19.
Okay.
There we go. So besides the accident that he had on the right-hand side of his mouth, we'll forget about that. But you can see where tooth number 19 is failing. He had a massive bony defect in there. I extracted 19. We're not going to show that extraction. Maybe another time we'll show that. But I just want to show you how we utilize Isolite in this grafting procedure. So 19 was extracted. We're going to go directly on now to the extraction.
There you go.
Okay. So we took the tooth out. Can you make that bigger?
Yep. There you go.
Okay, so we ended up taking out tooth number 19. I don't have that on video. I don't think I do anyway, but I have the grafting portion on video. So let's go ahead and let's get the graft going and show you how Isolite worked well and really helped me with this whole thing. So you want to roll that video and I'll talk through it as you roll it?
Yep, here we go. Ready?
Okay, local anesthesia was achieved, flap was laid, tooth was extracted. Okay. So the tooth is extracted. So pause right there for a second, Ro.
Yep.
Okay. So one of the things that you can see, I need to get my videos a little bit closer, but the tooth was extracted. And one of the nice things that you can see while I'm working throughout this whole procedure, go ahead and run and I'll talk while you're going, is the first thing that you can see is the patient is just totally relaxed. I mean, I'm in the middle of closing this up right now. I had actually put a membrane in there and packed some bone in there. But just notice right now just how relaxed the patient is. I'm not having to continue to tell him to open his mouth and strain to stay, or it doesn't have to strain to stay open. He's just relaxed and nice and comfortable. The next thing that you notice is I'm working in an area that's always challenging, the lower left-hand quadrant. And what happens is the tongue is always getting in the way of the procedure, and somebody has to be retracting the tongue. Well, nobody's retracting the tongue. It's just back and out of the way. So that's just another nice advantage about doing this. So as I place my sutures, the tongue is out of the way. We have the Miller retractor. I use that Miller retractor to retract the flap number 1 and to hold the membrane in place while I grafted this whole procedure. So I guess this video is just more on the closing of the graft rather than the actual grafting procedure itself. Suturing, I guess we'll just call this one suturing right now. So the tongue is out of the way and the Miller retractor is used to keep the cheek out of the way. And you can just see how nice and easily I'm using a continuous suture on this thing, a continuous interlocking suture. So as we just go along, I can grab the flap and try and keep my hand out of the way while we're suturing.
So, Dr. Hirsch,
yes.
Are you using a throat pack with the patient?
No, there's no throat pack in there at all. So the Isolite becomes my throat pack. As you can see, the throat is protected. And it's always fun suturing these things when somebody's got a beard because inevitably the suture gets hung up in the beard. And I will tell you this, Isolite does absolutely nothing about getting the beard out of the way. beards there. It's always such a challenge to go ahead and suture when somebody has a beard. The suture somebody's got a trick for me on how to keep this beard out of the way. I'd love to hear that one.
Now I noticed there's a bunch of blood in there. You have it all the way up. It looks like.
Yeah, I think the vacuum might be going full bore. Maybe vacuum's going, so it's aspirating the blood. And actually, one of the things that we talked about earlier before is in this procedure, make sure that you flush this with water every now and then so the blood doesn't coagulate in the Isolite. But you can just see we're just going at a really nice, relaxed pace, and this is running live. It probably took me 4 or 5 minutes to suture this whole thing. One of the things that you don't want to do when you're suturing is rush. Just take your time, suture one side, suture the other side, close it on up. I like this interrupted locking suture technique because we can just go ahead and just get one suture. It's easy to place. It's easy to remove. So tip number 1, keeps the tongue out of the way. Tip number 2.
I'm sorry, sir. I noticed, Danny, your assistant, is just holding the cheek back. You don't have to have an additional surgical suction in there. She doesn't have to retract the tongue.
No, everything's getting nice and dry. So yeah, Danny, my assistant, she's just keeping everything retracted, which is just nice. It makes her job easier, and she can concentrate on handing me what I need. And actually, you want to know what her job is? One of her big jobs right here: keep the suture out of the beard. And the other thing that you see right there, and I will tell you, this is a challenge, by the way. So is Isolite perfect for everything? No, because right now, Isolite, sometimes my suture will, as you saw her before, will actually wrap around the end of the Isolite right there, depending on how I'm placing the suture. And so her job is to make sure that suture just doesn't get hung up on anything. So that allows her to concentrate not even so much on what I'm doing in the mouth, but extraorally, keeping everything nice and clean. So we're just finishing up right here. I'm just going to grab the end of that, tie it off, and we're just about done.
That is fantastic. Thank you so much. I appreciate that. And if I understand,
and I'll learn how to keep my hands out of the way, so maybe you can see this a little bit better on whatever we do the next video on. This is a learning experience for me too. And then we need to get in a little bit closer on our next video shoot. But
there you go.
Got it. It's done. We got primary closure right there after taking that tooth out. And
beautiful.
This is in precursor to placing implants. So later on, we'll go back to the same procedure, and I'll show you maybe the implant placement procedure and what we did on that.
That is.
If anybody has any questions, call on in, or any comments, just let me know. But that's just how Isolite kind of aids you and makes your life a whole lot easier when you're suturing. And
through the course of last year, you shared with us a whole bunch of different tips. You mentioned that about putting water and all that type of stuff. Folks, if you want to kind of look at that, go to the Xyrus Dental Facebook page. You can see those videos there. If you have questions, or if there are certain kinds of procedures that you would like to see as we go through this next season, please let us know, and we can get Dr. Tom to look at it, and if he happens to do that. Otherwise, we're going to continue this series. Hope you like it. If you do, let us know. If there are things that you'd like us to add, let us know. Any closing comments, Dr. Tom Hirsch?
No, we're just going to do these videos. We're going to have fun throughout the year. This is our dental videos. Dentists, what I've seen over the years is dentists just like to look at videos. You walk through a convention hall and you're just kind of drawn to a video like a moth to a flame. And so that's what we're going to be doing. And I'm going to try and get some really good close-ups so that you don't have to strain so much. I could see from the one I just did, I need to be closer in the next video shoot. So we'll try and accomplish that. But everybody, if you need more information on your COVID stuff, go to the ADA website and see what you need to do if you want to offer that service to your patients. I think it's a really great place for patients to come, reintroduce them back into the practice, and let your patients know that you're really on top of this COVID thing. It'll be a boom for you. Anyway, everybody have a great new year, and hey, happy 2021.
Thank you, sir. If you like,
thank you, Rondo.
Ask us questions. Look forward. See you next week at Dr. Tom's Case of the Week. Have a great one. Happy New Year, everyone.
Happy New Year. Bye-bye.